This video provides instructions for the 3M Bair Hugger Patient Adjustable Warming Unit Model 875 and is intended for clinicians only. The 3M Bair Hugger Warming Unit Model 875 can be connected to all Bair Hugger Warming Gowns for pre-warming and/or comfort warming before and after surgery for all pediatric and adult patients. The Bair Hugger system is contraindicated for use on patient lower extremities when signs of poor perfusion are present. Prior to use, consult detailed product indications, limitations, safety information, and instructions in the provided operator's manual and preventive maintenance manual. Additional safety information specific to the product is available at the end of the video. The 3M Bair Hugger Warming Unit Model 875 consists of a warming unit, a warming hose, a handheld control unit with an adjustable holster, and a power cord. There is also an adjustable sheet clip available to help secure the hose. Be sure the unit is safely placed on a flat, hard surface, such as a table, or mounted on a wall, IV pole, suction wall mount adapter, or bed rail. There are optional mounting devices available, which allow for these mounting options. When installing the Model 875, it should be mounted near the patient's right shoulder to allow for proper hose extension to the hose port, located on the right side of the Bair Hugger Warming Gown. When mounting on an IV pole to prevent tipping, clamp the Model 875 Patient Adjustable Warming Unit to an IV pole at a height that provides stability. Clamping the Patient Adjustable Warming Unit no higher than 44 inches, 112 centimeters, from the floor on an IV pole with a minimum 28 inches, 71 centimeters diameter wheelbase. Connect the warming unit power cord to a properly grounded power source. At this point, the operation of the warming unit is done by the handheld control unit. Connect the warming unit hose to the 875 hose port found on the lower right side of the patient warming gown. With your finger, rupture the plastic film over the hose port to make hose insertion easier. To insert the hose, squeeze and hold the two buttons on the sides of the hose nozzle. Insert and release the buttons. You may have to slightly rotate the nozzle to release the clips into place. Check to make sure the hose remains inserted and the side pins are deployed properly. Never treat patients with the warming hose alone. Be sure that the patient is not lying on the warming hose or does not have any direct skin contact with the hose. You should support the hose by attaching a tethered sheet clip to the chair, gurney, or IV pole. To help provide secure attachment, you can adjust the tether along the length of the hose. To begin operation of warming therapy, turn the dial on the handheld controller clockwise, moving the indicator from the blue zone towards the red zone. The small power indicator light on the front of the warming unit will illuminate green, and you will hear the blower and heater activate. Allow the patient to adjust the temperature to a comfortable level by turning the knob up or down. The approximate temperature range is ambient air, room temperature, to 43 degrees Celsius, plus or minus 3 degrees. The overtemp indicator light will illuminate if the temperature reaches or exceeds 46 degrees Celsius. The alarm will sound, and the heater will turn off. The blower will continue to operate. If this occurs, discontinue warming therapy by turning the handheld controller off and disconnecting the hose from the warming gown. Unplug the unit from the power source, and wait 5 minutes before reconnecting to the power source and turning the unit back on. Run the unit on high setting for 5 minutes before reconnecting the hose to the warming gown. If another overtemp fault occurs in that time period, remove from use for service inspection by a qualified service technician. When warming therapy is complete, turn the knob on the handheld temperature controller counterclockwise until it clicks to stop operation. To disconnect the hose nozzle from the warming gown, press the two buttons on the sides of the nozzle and withdraw the nozzle from the hose port. Solventum recommends continuously monitoring core temperature. In the absence of continuous monitoring, monitor the temperature of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to your institutional protocol. Adjust air temperature or discontinue warming therapy when the therapeutic goal is reached. If elevated temperatures are recorded, or if there is an adverse cutaneous response in the warmed area. Once disconnected from the power source, perform cleaning in accordance with facility protocols. Wipe the warming unit, the handheld controller and holder, and the outside of the warming unit hose with a damp, soft cloth and a hospital-approved mild detergent, germicidal disposable wipes, disinfecting towelettes, or antimicrobial spray after every use. Consult the operator's manual for recommended cleaning solutions. Store the Model 875 hose in the hose clip atop of the warming unit, and return the handheld controller to the controller holder. The Bair Hugger Model 875 warming unit contains a dust filter. This filter should be replaced every 6 months or sooner if necessary. Prior to cleaning, disconnect the warming unit from the grounded power source. Do not attempt to clean the filter, as it may be contaminated from use. Discard the used filter in accordance with your facility protocol. Warning: do not leave children and other vulnerable patient populations unattended while using a Bair Hugger patient adjustable warming unit. Do not allow children and other vulnerable patients to handle the handheld temperature controller without supervision to prevent controller's electrical cord from becoming entangled around the patient. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on the risk of thermal injury, altered drug delivery, interference with ventilation, risk of strangulation, and hazardous voltage and fire, applicable to the use of the 3M Bair Hugger Warming Unit Model 875, which can be found in the device operator's manual provided with the warming unit. The Bair Hugger warming system should only be used by trained medical professionals. If you have product questions, please contact your local Solventum representative. Call the Solventum customer care at 800-228-3957 or visit solventum.com. Solventum offers device training upon request.